friends, welcome to Easy Nurse, where nursing education made easy. So as you guys know, your exams are coming for PPBSC second year. In this session, I'll be discussing the most important question of your syllabus, okay? And one by one, we will discuss all of the subjects, and from that, I have shortlisted some of the most important topic from where most of the questions, like 60 to 80% of the questions will definitely come. Okay, so from that, most of the question, like around 60 to 80% questions will come. And if you want to know in detail, so keep it up with the video. So let's get start our session. So in second year PBBSC or post basic BSc nursing, we have around 6 subjects. Okay, what are those? Those are sociology, community health nursing, mental health nursing, nursing research statistics, nursing service and administration, and nursing education. Okay, so some of the subjects are very easy, but in that you may get confused which questions can come and which will not come, okay, and which subjects you need to prioritize most to get more marks. Okay, so in this session I will be discussing all of that. So let's get start with our session. In the first, we will discuss about sociology. So what is mean by sociology? Sociology is actually the study of the society. As a nurse, when you are giving any care, any kind of nursing care to the patient, their family, or in a community or in a group, you have to understand the term, you have to understand what society they belongs to, not in the sense of judgmental, but in the sense to understand what care they need, okay, and especially in the cases or to study the demography and to understand the rules regulation of a person's particular society. We need to understand from where they have come, what is their actual cultures and background, okay. Sorry. So in sociology, we will study about the society, their norms, regulations, whatever the cultures, and what is the difference between different society and all. Okay. So our first chapter in the syllabus as per INC is Introduction to Sociology. So what are the things that can come in the exam? That will be definition, nature, and scope of sociology. Like, what is the definition of sociology? Okay, what is the nature of sociology and what are the scopes? Scope in the sense where we can apply the sociology. Okay, now you are studying a sociology, you have to understand where you can apply that thing. Okay, or else it will be no use, right? Or to study sociology. So that is come under scope of sociology. Other than that, in the same chapter, the significance of sociology in nursing practice, especially in application of health, illness, and the community. Okay, so from introduction to sociology, first chapter, these things will come. Okay, and this will become around in between 2 to 5 marks. Okay, maximum the 5 marks can come from the scope of sociology. Okay, and all of the other topics can come around 2 marks questions, okay, short answer questions type. And if you want to in detailed description, it is still there in our app as well as the YouTube. We will go through the live session of that. In between, we will discuss it more. Okay, just for now, just try to write it down what are the important things, so later you can go and study by yourself, or you can watch the YouTube video in the Easy Nurse app. The next one is second chapter, which is social structure and social process. So how the society is being made, okay, and what are the structures, what are the levels of the society. Okay, so here we will understand the concept of society, community, association, and institution. Okay, and we will also study about social groups, the meaning of social group, what is the characteristics, classification, then social process such as cooperation, competition, conflict, assimilation, accommodation, etc. Okay. The next one is socialization. Okay, how a person, like as a nurse, especially for the nurses or the medical health staffs and all who are related to healthcare system, they have to socialize with other people. Or if you are staying in a community or in a particular region, at that time, no matter you are a nurse or a professional or not, you should socialize with other people. Okay, to accompany them, also to stay along with them. Okay, so that is actual socialization. So in this chapter, we will also learn about definition, process, and agencies. The next is social changes. Okay, how the society changed from decades to decades. Okay, in the centuries, in the 19th centuries, what was happening, in the 20th centuries, what was happening. Okay, and the 21st century, what are the social changes and what are the trends will be there. Okay, that we will study under the nature, process, and the role of a nurse in social changes. Okay, so from this two chapters, these are the important things that can come in exam. And from the second chapter, mostly 5 marks will come. That is especially the most or very important are socialization and social changes. And you can include social process too. It can come for 5 marks, or sometimes like it most probably will come for 2 marks only. Okay, so these are the two chapters. Come to the next chapter, which is social organization, disorganization, and social problems. Okay, so this is the next chapter. In this chapter, the social organization, social disorganization, major social problems, vulnerable or managerial groups, and role of nurses in addressing and intervening in social problems. Okay, so these are the main topics. Okay, in between that, social organization, what are the elements of social organization and disorganization will come, and why the social disorganization can happen. You may have heard sometimes the terrorist attack, okay, or some civilians have attacked any hospital, or this kind of thing, the terrority, okay, the terrorism, this kind of thing will come under the social disorganization. Okay, and then major social problems. The major social problems in our society is mainly poverty, housing, literacy, substance abuse, HIV/AIDS, child labor, etc. Okay, the question can come from this is, what are the main factors of social disturbance that change the society, okay, or that affects the society health. Okay, that is this points. Okay, next is vulnerable or managerial group. Okay, so what is the vulnerable and managerial group? This group will come under a circumstances where we need to take care more of them than the other general people, because they are vulnerable, or they are prone to get attacked, or they will be easily disturbable in the society, okay, through the other people who are not socialized, okay, who are disorganized people. Okay, so especially in this they will come elderly, handicapped, and minorities. Okay, lastly, as a nurse, how we can address those things, organization and disorganization, how we can manage them, and what is our role in the particular thing. Okay, so these things will come under social organization and disorganization and social problems. From this, 10 to 5 marks questions will come. Okay, at least one question will come. Okay, if 5 marks question it is there, then it can come for 5 and 1 2, or it can come only 10 marks questions 1. Okay, this is a very important chapter. Okay, this is a very important chapter, to try to remember that. Next chapter is clinical sociology. Now, clinical sociology, why it is important? It's an important chapter, but from this, mainly 5 marks question will only come, because as a nurse, how you are applying the sociology, whatever you have studied, how you are applying it to the society, in the benefit of the society. Okay, so in this chapters, the meaning and the importance of clinical sociology, application of sociological knowledge in hospitals and communities, strategies for crisis intervention, especially as I told, natural disasters and all, in this kind of thing, dealing with the social factors, illness, family, and patient environment. So these are the main important topics in these chapters. Okay, from here I can say 5 marks or 2 marks can come, or sometimes they will skip also. Okay, this is not a very important chapter, but still try to understand this. Okay, and at least if you feel any kind of confusion, comment box is there. You can comment and ask for help from the easiness, or you can go and search the videos in YouTube and see whatever the explanations are. Okay, the next subject we will discuss is community health nursing. Okay, so what is community health nursing? Community health nursing is actually a subject where we will study about community, and as a nurse, how we are giving care not to the individual, not to only a family, but along with the community, how we are giving care, how we are taking care of the community will be studied under this subject. Okay, so first chapter is Introduction to Community Health Nursing, where we will understand the definition, scope, principle, evolution, philosophy, functions and role of community health nurse. From this chapter, the main and the most important question can come from 2 marks will be role of community health nurse and the function of community health nursing. Okay, these are the most 2 important questions. Okay, from here 2 marks will definitely come. The next is health and disease. Okay, this is a very important chapter. Okay, health and disease. In this we will study about dimensions of health. Okay, like physical, spiritual, okay, holistic dimension, biological dimension and all. Dimension and determinants of health. Determinants in the sense that things that actually control the health of a individual or a family or a community. Natural history and levels of prevention. Okay, so the natural history of the community health nursing and the levels of prevention, like primary, secondary and tertiary. In the primary we will try to avoid it with the vaccination and normal maintenance of hygiene or maintenance of lifestyle. In the second stage we will try to give the proper care to the patients, okay, to cure from the particular disease. And in the last stage we will try to suppress the symptoms and we will give the maximum critical care. Okay, so that is come under the levels of prevention. Next one is concept of disease control and prevention. Okay, how we can prevent a particular disease. Okay, especially the difference between the communicable and non-communicable disease. The communicable disease we can be avoided by PPE kits, okay, taking safety measures. But in the non-communicable disease, we have to careful about our genetics, okay, genetic counseling, and along with that the lifestyle modifications, diet plans, our behaviors, okay, these things will come under that. So this is a very important chapter. From here 5 or 10 marks can come. Next is epidemiology. Okay, there are at least 3 to 4 years in between last 6 to 7 years. If you see, there will be 2 to 3 times it came what is the definition of epidemiology or what is epidemiology. Okay, so the definition, aims and methods of epidemiology. Epidemiology is the thing where you will study a population. Okay, there will study a population, you will understand what is happening in the particular area, okay, how the disease are spreading, okay, who are the vulnerable group that are getting attacked by the particular disease. So that will be come under epidemiology. There we will study definition, aims and methods. Then morbidity and mortality, especially the rates. Okay, try to understand the calculation of morbidity and mortality rates, infant mortality rates, under 5 mortality rates, okay, maternal mortality and child mortality rate. Okay, these things we will study. Morbidity in the sense how much, like what are the patients that have diagnosed with particular disease, okay, what is the ratio, and mortality in the sense who have died already. Okay, so that is, this is disease, that and this is death. Okay, indicators and all we will study, and what are the factors that can increase morbidity and mortality rate in the community. The next is use in community health nursing, how the epidemiology is used. Okay, like as a nurse, if you study about epidemiology, you can understand the particular community and you can understand what are the factors, what are the determinants that are actually maintaining that. Okay, so we will understand the use of community health nursing. From this 10 marks questions will definitely come. Okay, the next is community health problems in India. Okay, so community health problems in India mainly divided into 2 types, communicable disease and non-communicable disease. Now come to communicable disease, we will understand what are the types, okay, what are the major communicable disease, okay, what is the eradication programmed by the government, when it is established, what is the aims, what are the objectives, especially tuberculosis, write it down, tuberculosis for the communicable disease. Okay, tuberculosis, then whooping cough, HIV or AIDS. Okay, and other than that, influenzas. Okay, coronavirus, last just some years ago only it happened and it became a pandemic. Okay, so this communicable disease, and under non-communicable disease mainly iodine deficiency disorder, anemia. Other than that, you can also study the heart and heart diseases, kidney diseases. Okay, these are non-communicable diseases. Okay, other than that, we will also study about malnutrition, population issues, sanitation and pollution. Okay, different kind of pollution, how the pollutions are affecting our health and environment. Along with that, we will also study about the sanitation, especially the sanitation of water, how we can sanitize our water. Okay, so these are the things come under this. From this chapter, at least 15 to 17 marks will come. This is a very, very important chapter, like most important chapter in the community health nursing. Okay, now next chapter in community health nursing is environment and health. Okay, so in the environment and health, we will study about what are the components of environment. Now, in the components of environment, there will be animals, there will be living things and non-living things. In the living things, what are the things will come? Humans, other animals, microorganisms, insects, butterflies, anything can come. Okay, which are living organisms. And in the non-living, there will be like water, land, okay, then air. These things will come under the non-living things. Okay, so the components, how to do the sanitation, proper sanitation and waste disposal. In this, there is a very important topic which is called as biomedical waste management. What is biomedical waste management? Let me remind you guys. So biomedical waste management is a management process of a waste which is coming from the healthcare centers in the process of caring or in the process of giving care to the patients. Okay, so that is biomedical waste management. There are different color codes I have already discussed, and some of the other teachers have already discussed in the YouTube channel. You can go and search for that. So that is come under component, sanitation and waste disposal. Other than that, water purification and vector control. In the water purification, large scale water purification and small scale water purification, how government does the water purification program for our drinking water, and especially what is underground water, what is how we can store the water, how we can filter the water inside home and chemically we can do. Okay, these things will come under water purification. Water purification came 2 times. Okay, last 2 times it have been came already. From here again 5 or 10 marks will come. Okay, and vector control. Vector control in the sense the insects or you know, the organisms that actually causing problem to our health. Or vector in the sense, if we see about the definition, vector is actually a thing which is carrying the microorganism from the diseased person to the next healthy person and making him or her ill. Okay, so that is actually vector. So how we can do vector control, like flies, home flies, okay, then mosquitoes, rodents, especially the animals like mice. Okay, these things, and cat and dog, how they are bringing the illness into from one person to other person, that will come under this. Okay, so from here 5 and 10 marks questions will come. The next chapter is family health nursing. Now in the family health nursing, we will study about what is family, what are the types of family, okay, and family as a unit of service, home visit and back technique. This is a very, very important topic, which is home visit and back technique. Back technique can come for 5 to 10 marks. Okay, 10 marks it will not come maybe, but 5 marks it will be definitely come. Okay, 5 or 2 marks. Okay, so home visit and back technique is a very important topic. And what is actually back technique? Back technique is actually a process where we will giving care to the community as a group or maybe as an individual during the home visit, with carrying a bag which will include different types of product and different types of equipments through which we will give the care. Okay, there will be sterile, non-sterile compartment, disposable compartment, many things are there. Okay, so just to explain you guys, I have told. Okay, so back technique is again very important. And records and reports. Okay, this can come, but just for study, you just you know, have a look what is reports and records, why it is important. Okay, especially it is important because to take care of evidence. Okay, evidence, and to keep some records like what are the cares you have been giving. Okay, the next chapter is maternal and child health nursing. In maternal and child health nursing, under 5 clinic Antenatal, prenatal and postnatal care is very important. What are the drugs you are providing, what are the care you are giving, or what are the advice and suggestion you are giving as a nurse, as a community health nurse to the mother, okay, or becoming mother, okay, will become under the maternal and child health nursing. Other than that, immunization schedule and cold chain. Okay, immunization schedule is again a very important topic. 5 marks or 2 marks can come. And cold chain also, last two times it have been already came. What is cold chain? Cold chain is a process where we are maintaining the quality, okay, quality and sanity of the vaccination from when it is releasing from the warehouse to the consumers. Understood? Okay, so this is come under cold chain. And the role of nurse in maternal health care, maternal and child health care. And lastly, school and occupational health nursing. School health services, what are the school health services, how we can give care as a nurse in school health services such as dental care, eye care, okay, then measurements, the nutritional assessment, okay, these things will come under the school health services. 2 marks can come or 5 marks maybe come, or sometimes it actually don't come. But this is the very important topic in this chapter, which is occupational hazard and prevention. Okay, how a particular occupation is affecting someone else, okay, especially the coal workers and mine workers, okay, they can be affected by their particular type of work. Okay, so this will come under school and occupational health nursing. From here 2 or 5 marks questions can come. The next chapter is health and education and communication. Community health nursing is little big, but once you will understand, you don't have to go and read again and again. Okay, this is a very easy subject, I can tell. But the eradication programs like the communicable and non-communicable disease control programs and Indian health scheme, okay, these things may be little difficult, but other than that all subjects are very easy. You are studying from childhood only. Okay, so you just have to make a remind like what is this. Next is health education and communication. Okay, how we can do the health, how we can provide the health education, what is the meaning of health education, what are the principles and all. Okay, so principal, methods and media we will understand. IEC BCC strategies. The next chapter is healthcare delivery system. Now healthcare delivery system, again a very important question, which is PHC and CHC. Okay, primary healthcare and community healthcare center. Okay, so in the PHC and CHC, what are the structure, what is the framework, okay, what are the main aim of PHC and CHC, and what are the different types of care and services that we are providing to the community will come under this. Then health committees and planning, health team and their functions, like who all are in the team, who should be there in the community health team. Okay, these things. So this will, from here main important is level of care and health team. Okay, the next one is national health program. Now national health program here will be discussed. Okay, RCH, NTP, NACP. Okay, these things will come. And other than that, role of nurse in implementation of those nursing health programs. Okay, from here 5 marks can come. Then primary health care, which is concept, principles and elements, Alma Ata, declaration, SDGs, okay, community participation. So these are the main chapters. In the last 2 chapters we have vital statistics and health information, where we will understand about birth, death, registration, health indicators and their rates and records and reports. Okay, and the next chapter is community health nursing process, where you will understand the assessment, diagnosis, planning, implementation and evaluation. You have already studied in nursing foundation, so no need to focus more on this chapter. Okay, role of community health nursing, where you will understand what is the role of community health nurse, how she is giving care, okay, how she is educating the persons, okay, how she is working as a supervisor, manager, researcher and advocate. Okay, so these are the main topics in community health nursing. The next subject we have is mental health nursing, where we will study about the mental health, how we can control, how we can solve the problem of mentally ill or mentally unhealthy persons. So let's see the first chapter, which is introduction to mental health nursing, where we'll understand the concept of mental health and mental illness. Next is history and scope of psychiatric nursing. how this in the previous decades, okay, how the mental health nursing have taken care of, okay, those things we will study. Then role of qualities of a mental health nurse, mental health team, and multidisciplinary approach. So from the first, this is the only important thing, okay, just study once but focus more on the mental health team and multidisciplinary approach. The next chapter is mental health and mental illness, okay. So what is mean by mental health, okay, and how, when we call a person that she or he is mentally health, what are the characteristics, okay, and when we can tell, okay, no, this person is not mentally healthy, okay, these things we will study under characteristics of a mentally healthy person. Then causes and factors that influencing mental health, either it is creating problems or affecting the mental health, or somehow it is increasing or it is doing a favorable for the person, okay. So the causes and the factors influencing the mental health. Next is classification of mental health disorder. From this 5 or 10 mark question definitely will come, 100% from this it will come, okay. So that is ICD classification, okay. Next chapter we have is principles and standards of psychiatric nursing. So in that we will understand about nurse patient relationship, especially in the mentally unhealthy person, therapeutic communication and environment. What is that? In the process of giving care to a patient, where whatever the communication or whatever the information is transferring in between the caregiver and the patient will be considered as the therapeutic communication, okay, and how the environment we can make for the therapeutic communication, these things, okay. Legal and ethical responsibilities, some legals and ethical responsibilities are specially have mentioned for when we are giving the care for the mentally unhealthy persons, okay. There are unbreakable laws which we should follow, okay. The next chapter is assessment in mental health nursing, okay. Mental health status examination, what are the assessment process through which we can assess these things, okay. Then history taking and observation on the patient, recording and reporting. In here the mental status examination is the most important. From here 5 marks or 10 marks question can come. The next chapter is treatment modalities in psychiatry, okay. What are the treatment modalities, facilities are there to treat the patient, okay. First one is psychotherapy, which can be given as an individual, group or family, okay. Then behavioral therapy, which is a occupational therapy and behavioral therapy also it include, okay. In most of the severe cases we usually give behavioral therapy, occupational therapy and play therapy, okay. Then electroconvulsive therapy, especially in the schizophrenia cases, okay, this kind of cases, or bipolar disorders, we usually give electroconvulsive therapy, where in a particular frequency we will give electric shock to the brain and the nerve of the person to make him mentally healthy, okay, or to control their symptoms and thinking, okay. So this is electroconvulsive therapy. The definition, the principles are very important for this, and how we can give or how we can take care of a person after giving the electroconvulsive therapy, that is very important. It can come for 2 to 5 marks, okay, and this can also come, okay. These are very two important things in psychiatry. The next one is psychopharmacology, okay. Psychopharmacology, like what are the drugs that we usually provide to the person who is mentally unhealthy, okay. Then disorders of thoughts, mood and perception, okay. So in this chapters we will study about schizophrenia, psychotic disorder, mood disorders such as depression, mania and bipolar disorder, anxiety and obsessive compulsive disorder or OCD, okay. From here schizophrenia, OCD and the disorders, okay, mood disorders are main important. You can tell in this chapters all of the things are important, because 2, 5, 10 marks, 3, all of the 3 types of question can come from this chapter, okay. Next is neurotic and stress related and stoiform disorder, which includes phobia, panic disorder, post-traumatic syndrome disorder, conversion disorder, okay, and nursing management and intervention for that particular persons, okay. From here 5 marks questions will come. I especially try to study the suicide, okay, suicidal attempts of a person, how a nurse will take care of a suicidal person, Okay, the next chapter is substance use and addictive disorder, where we will study how a substance can actually harm patients' mental health and how they are being dependent on this. Okay, like alcohol, using alcohol, drugs, tobacco dependence. Okay, how we can detoxify them, how we can rehabilitate them. Okay, so detoxification, rehabilitation, and replace relapse prevention. Okay, these things will come under this. Okay, from this, the alcohol substance disorder is the most important one. The next chapter is child and adolescent mental health disorder. So from this chapter, the main important thing is ADHD. Other than that, we have autism also, but the ADHD is the most important one. And as a nurse, how we can provide the guidance, or how we can conduct a clinical settings, okay, to encourage the children and all. And the last chapter we have is personality disorder and sexual disorder, their types, features, and nursing care. So these are the chapters of mental health nursing, and what are the most important topics I have already discussed. Okay, in between that also there are some very important questions. Okay, so try to give answer on that when the questions will come. If you still feel difficulty, go in the EasyNurse app, search for the video will be there, and try to go study for your exams. The next chapter is organic brain disorder. In this chapter, the main important things are delirium, dementia, Alzheimer disease, and epilepsy. From this, epilepsy, Alzheimer, and delirium is the most important one. Okay, from here 5 marks question can come, 10 marks can come, or even 2 marks can come. Okay, and from this chapter you have to understand about the nursing management, especially for the particular diseases, how we can take care of the particular patient with this disease. The next is suicidal behaviors and crisis intervention, where we will understand why this behavior can cause, okay, warning signs, and how we can prevent suicides. Okay, and what is the nursing role or the nurse's role in crisis management. The next chapter is community mental health nursing, where we will understand the concept, objectives, and principles. National mental health program. Now again, it's a very important topic. Okay, so don't forget to study national mental health program. When it have been established, what are the aims, goals, objectives, what are the criteria, what are the principles, what are the healthcare team members are present in the program and all. Then role of nurse in community psychiatric service. The next is forensic psychiatry, where we will understand the legal aspect of psychiatric nursing, admission and discharge procedure, rights of mentally ill patient. From here 2 marks question can come or may not be come. Okay. Next is rehabilitation and psychiatry. Again, it is very important chapter, and from this the principles, types like social, vocational, and occupational rehabilitation, and the role of nurses in rehabilitation can come. Okay, so this is the main important questions in this chapter. Okay, and what is the meaning of vocational, social, and occupational rehabilitation? Okay, so these are the main important things in this chapter. So I have discussed all the topics. Okay, if you still didn't get it, just rewind it and see what are the main important topics. Okay, our next subject is introduction to nursing education. What is nursing education? In nursing education subject, we usually study how a nurse will study and what are the things a nurse should study during the period of their particular professional degree. Okay, it can be BSc, GNM, ANM, anything. Okay, so as a nurse, what are the things we should study? What are the how we can study as a teacher? How, if I am a nursing teacher, how we should make them study? Okay, and what are the teaching and learning methods? This all things we will study in the nursing education. It may seem a little difficult than the other subject because you are not. It is not related to directly to health. Okay, but once if you study and understand the topic, you can able to write the answer on your own. Okay, so we will start with the introduction to education, where we will understand the meaning, aim, function of this, the philosophy and principle, educational trends, and impact on nursing. From this, the main things can come is aims and functions of introduction to education. The next is teaching and learning. Okay, teaching and learning processes, different types or methods of teaching and learning, meaning and principles, factors that influencing the learning, and teacher's role and learners' characteristics. Okay, these are the important things. As I told, from here the methods are the most important one. Okay, methods of teaching and learning. The next is teaching learning process. So in the process, we will study about the steps and maxims of teaching. Maxims of teaching in the sense, the things that actually controlling the quality of teaching. Okay. Then levels on theories of learning and adult learning principles. Okay. So if you want to make study the adults as a teacher, what are the principles you should maintain, okay, while giving the teaching. The next chapter is methods of teaching, where we will discuss the lecture, demonstration, discussion and seminar methods of teaching. Then role play, simulation, micro teaching and all. Other than that, the clinical teaching methods, bedside clinic and round conference. From here, I can't tell a specific question that will come from this chapter. The whole chapter is very, very, very important, okay, and from here at least 15 marks can come, okay, at least. So this is the most important chapter on this whole subject, okay. The next chapter is educational objectives and lesson planning, where we will study the Bloom's taxonomy. This is very important, 2 or 5 marks question can come. Then we will study about the writing behavioral objectives, how to form a lesson plan and what are the steps to form a lesson plan. Then teaching aids. What are the teaching aids? Aids in the sense that the props, or you can say, if in a frank English, the props we are using to teach the students, okay. So that can be audio aids, visual aids or audio visual aids, okay. So what are their preparation, how to use them, how to evaluate them, what are the types of visual aids, what are the types of audio visual aids, okay. Other than that, principles of effective audio visual aids, okay. So these are the things we will study under this chapter. This chapter is again very, very important, okay. Types and preparation and evaluation of this, okay. Next is measurement of and evaluation, how we can measure a student performance or a teacher performance in teaching, okay. How we can evaluate a student, okay, whatever they have learned, okay, in academic area. Then purpose and principles of the evaluation and measurement. Types and tests of assessment tools. It can be a mock test, it can be annual exam or half yearly exam, it can be a surprise test, okay, it can be anything. And there are different types of questions, okay, question patterns, how to make questions, okay. These things will come. And other than that, qualities of a good test like validity, reliability and objectivity. And the next chapter is guidance and counseling. Now again, counseling again is a very, very important chapter. From here 10 to 5 marks questions will come, okay, note it down. The meaning, purpose and types of counseling here is the main important thing. Other than that, the counseling process and principles and role of a nurse as a counselor, okay. So these are the important topics in the guidance and counseling. These two, teaching aids and guidance and counseling, are the most important chapters. Next is administration and supervision, where we will plan and manage the programs. Supervision, feedback and staff development will also be included in the chapter. It's not a very, very huge chapter, very small chapter, easy to understand. If you don't want to, skip 2 marks question, you can study from that. Next chapter is curriculum development, where we will study about the meaning, types and steps, principles of evaluation and revision. The next is educational trends and technology, where we will study about the innovation and e-learning. We will study about the use of computer, distance and continuing educations. And lastly, the role of a nurse as an educator, as a teacher, as a facilitator, as a counselor, as an evaluator and as a researcher, and how a professional goals and ethics can make them good in these roles, okay. So these things we will study in the nursing education, and the important chapters I have already told. Next subject is introduction to nursing service and administration. That may seem a little different from all other things, because here we will study how a nurse will take admission in the particular college for PBBSC and all, and how they will study inside that, what are the framework, what are the structure of a college, okay, these things. So the first chapter is introduction to administration and management, where we will study the meaning, principles, importance, difference between administration and the management, levels and elements of management. Then theories and functions of management, like management theories. This is very important chapters again. And functions of planning, organization, staffing, directing, coordinating, controlling, okay. The second chapter is very, very important. From here 10 to 5 marks question can come. Next is organization of nursing service, where we will study the structure and function of the nursing department. Okay, this is a very important role of a nurse in administration, hospital and community. Okay, policies and procedures. Okay, so these two are very important topics of this chapter. The next one is planning in nursing administration, where we will study the process and importance of a planning. Okay, types of planning like strategic, operational or manpower, then budgeting and resources management. Okay, in this, budgeting again is a very important topic. Okay, come to the next chapter. We have human resources management, where we will study about the recruitment and promotion process of the nurses. Okay, what are the levels of nurses promotions? Okay, what are their job descriptions, specifications, staff welfare and motivation, and how they can get the appraisal. Next is staffing and scheduling. This is the very important chapter. Okay, human resources management. Next is staffing and scheduling, where we will understand what is the staffing norms, what are the principles. Okay, what is the patient classification, and how to make a duty roster. What is duty roster? Okay, how to handle a duty roster. Okay, these things we will study under this staffing and scheduling. Duty roster here is the most important one, and patient classification also. Okay, the next chapter is material management. Okay, so while you are working in a hospital, in a college, okay, what are the materials will be there? Healthcare materials through which, or the equipment through which you are giving care to the patient. Okay, how to manage them? So procurement, storage and inventory control, the principles of supply and equipment use, these things will come under the material management. From here, these two are very important. I can't choose a single one in between them. This is a very important chapter. The next is leadership and supervision, where we will understand the leadership styles and qualities, the supervision methods and staff motivation. The next chapter is coordination and delegation, where we will study about the principles and techniques, the delegation of responsibility and authority. Next one is control and evaluation, where we will understand the control process and evaluation tools, nursing audit. Okay, after the whole year of work, how you can assess that how you can understand whom to give appraisal and whom to not. Okay, what is the quality of the nurses care and their work. Okay, we will do it by nursing audit, the quality assurance and records and report. Here the nursing audit and quality assurance are the most important thing. The next chapter is legal and ethical issues, where we will understand the law and ethical principles in nursing, codes of ethics, discipline and grievance handling. Here the code of ethics and grievance handling are the most important one. Next is in-service education. In-service education is very important, especially in nursing education and the staff development. There we will study about orientation, continuing education still after, like, if a person is already done their BSc, MSc, PBBSc or maybe PhD also, but still they will be learning while they are in the occupation. Okay, because nursing is a continuous education process. Okay, and there we will see about the career advancement, role of our administration and training, role of a nurse. Okay, so from here mainly the continuing education and career advancement is the most important. 5 to 2 marks can come, 5 marks maybe it will not come, but 2 marks it will definitely come from this chapter. Okay, and the last chapter is trends and challenges. So here we will study about the professional development and leadership, modern trends like TQM, NABH and acceleration, technology and digitalization in administration. Here the modern trends are very important and the technological and digitalization in administration are important. Okay, so these are the important chapters and their particular important topics. The next subject is nursing research and statistics. In the nursing research and statistics, we will understand how to do a research. Okay, this is the speciality of doing a BSc degree also. Okay, especially in BSc and MSc degree, the scientific degree of nursing. Okay, research is the most important. So in this chapter, we will study about the definition, purpose and characteristics. Along with that, we will study the importance of research in nursing. What are the steps that includes in the process? Okay, the next chapter is research problem and reviewing the literature. Okay, so to do a research, first we have to find a research problem. Okay, so problem identification, objectives, hypothesis, these are very important things, and review of literature and purpose. So from this chapter, this part is very important. From here 10 to 5 marks question can come, and from here the 2 marks question will come. Okay, the next chapter is research approach and designing, where we will study about the qualitatives and quantitatives and what are the approaches. Then we will study about the types, design and descriptive, experimental, exploratory. Along with that, we will understand about variables and their control. Some are the controllable variables, some are the non-controllable variables, okay, and some are dependable and non-dependable. Dependable in the sense the variables which can control the result, and non-dependable which if they will change also, there will be no difference in between the results. Okay, so the variables and their controls. The next is sampling and data collection. In the sampling, we will understand about the population sample and sampling techniques, probability and non-probability. Again, this is a very important topic. Then sampling error and sample size. From this chapter, probability and non-probability is the most important topic. Next is data collection. Here we will study about the types and sources of data, the tools and techniques like questionnaires, interviews, surveys, okay, and observation. And lastly, validity, reliability, pilot study and procedure. So this is the most important chapter in this whole subject. Okay, and the types from the tools and the other types of collecting the data, the methods and all, these questions can come from here. 10 to 15 marks question can become, okay, it can include 5 marks, 10 marks and 2 marks questions also. Okay, the next chapter is communication and utilization of research. Okay, so how communication is important in the research process, like report writing and structure format, abstract, introduction to methodology, result, discussion, conclusion and references, dissemination of application of research in nursing practices. From here 5 marks question only can come, it is not that much important. Okay, next is introduction to statistics. Now this is again a very important chapter where we will study under the what is the scope, what is the use of statistics in nursing. Okay, the data type, how to collect the data, how to classify it, how to present it, okay, in the table, chart and graphs, different types of table, different type of charts and graphs. Okay, then how we can do the presentation methods, then measures of the central tendency, mean, median, mode. Now again this is a very important chapter, and I will tell you that in between the statistic and research, one 10-mark question will come from research and one 10-mark question will come for the statistics. Okay, and other than that we will also study about the variability, the range and SD, and especially how to measure them. Okay, mean, median, mode and variability, how we can measure them, how we can calculate them. Okay, in the examination hall you can see, if you see the previous year questions also, there have been one statistics question where the calculation will be asked. Okay, then probability and normal distribution. So this whole chapter is very again important. I can't divide in between that. All of this you should study. It is already there in the EasyNurse app, you can go and check. And then next chapter is analysis and interpretation of data, like how to encode and decode it. So editing, coding and tabulation of data, quantitative and qualitative analysis, descriptive statistics such as mean, median, mode, SD and percentage, interstitial statistics, t-test, okay, chi-square, correlation and ANOVA, which is the basic idea we have to study about, then interpretation and finding the drawing conclusion. Okay, from here quantitative and quantitative analysis difference can come. Okay, and descriptive statistics like mean, median, mode, SD and percentage. Okay, these two topics are important in this chapter. The next chapter is ethical consideration in research, which is informed consent, confidentiality and anomaly, research and ethics and right of the participants. Okay, so as a nurse, whenever you are doing the research, okay, you are involving the community people or some other peoples. Okay, so whenever you are including them, you should have to be always confidential according to their actual, not revealing the actual identity. Okay, other than that, research ethics and right to participations. Okay, these things will come under the ethical consideration and research. From here 2 marks question can come. And lastly, use of computer in research, how we can use the computers or the digital network, okay, like data entry, analysis, presentation using the computer software, using OSPSS, Excel and similar tools, okay. So these are the main important topics from this chapter. So in this whole session I have discussed all of the 6 subjects, okay. Try to remember whenever you are giving an answer, try to understand whatever the question have been asked, okay. If it is a 2 marks question and 5 marks question, maybe you know about the question way more, but try to give a actual answer whatever they have asked. Don't try to stretch the answer. Sometimes it can disrupt the view of the evaluator, okay. And especially for the 2 marks question, try to give pinpoint answer, okay. Whatever they have asked, just give that answer. And for the 10 marks, I will tell you, give the introduction, definition whenever you are discussing any kind of type or any kind of differentiation, okay. Especially for the types, or they maybe have asked the classification and all, or methods, okay. Whenever you are discussing that, try to discuss in such a way that the structure will look good, okay. How we can do that? If the type have been asked, make a flow chart, okay, make a hierarchy and describe it. Once it has been described, or maybe have asked process, so draw a process, okay, in a circle or in a square manner, whatever you want, but make it clean and neat. And after doing the normal or the main steps, after including in the process or after classify them, then you start to describe it. Because if you continuously, if you do sudden paragraph, write it sudden paragraph, the teacher will not focus on the answer, rather than he will see that you have written a paragraph, okay, and they will not read that much, okay. And especially in the 10 marks question, try to write it point wise, okay, so they can give you the marks as per the points, okay. So these are the suggestions I will give you. So best of luck for your exam. See you in the next session. Till then, keep learning and keep exploring with easiness. Thank you.